Hi everybody, this is Dr. Sue from Purely Peas. I'm sitting outside today. It's Memorial Day. I hope you are all having a wonderful day with family. It's absolutely beautiful. I don't want to say how hot it feels because I don't want to complain, but it does feel absolutely wonderful. I wanted to continue our discussion about constipation. And you'll find the audio talking about diagnosis of constipation and who generally gets constipated and why in the previous audio that I had done. So this video, I'd like to talk more about management. And at the end of the audio that I had previously posted, we talked about diet is always a factor in some way, shape, or form. And there are children and adults who have tummies that move slower, colons that move slower. And those are the people that generally we have GI, gastrointestinal specialists, help us with to understand how to help these people the most. The majority of people that are constipated are really constipated mostly because they're dehydrated and they don't tend to take in the foods that can help to keep stools nice and soft. So in terms of management, I want to talk first and remind you that breastfed babies that are exclusively breastfed are never constipated. And again, constipation is hard stools. And again, if you're dealing with constipation that's chronic, you're going to see children and adults that actually can have leakage of stool around the hard stools. So, you may see that as well. And I wanted to make sure to let you know that. In terms of management, what I always do is I ask about diet. And the things that can be most constipating that I want you to be aware of are dairy products. Anything that's dairy, cow's milk based, even goat's milk is considered dairy as well. Those are yogurts, cheeses, milk, goat's milk, anything dairy in terms of cow's milk or goat's milk is considered very constipating. Kids that tend to drink a lot of dairy or eat a lot of dairy are the ones that we really start to talk about minimizing that with families. And oftentimes that helps, and it can help tremendously. Kids love dairy and some adults love dairy, even ice cream, So what you might want to do is start looking at some alternatives that may be more helpful and dairy-free that are considered more like the coconut milk. You've got oat milk, things like that you can use. But making sure you limit dairy is really going to be a very, very good start. Bananas are very constipating too. So and they're easy to give. You can, unfortunately, you can just take that banana, peel it, and give it right to your little one, have them hold it as they're walking around. But unfortunately, bananas are very, very constipating. So I always tell families, if you're going to give banana, limit it to twice a week. And if you have a little one that's less than school age, half a banana at a time. A whole banana for us is like 2 bananas for them. So make sure you're limiting bananas as best as you can. I wanted to also bring up that the foods that are white products, such as white rice, white potatoes, white breads, all of those lower fiber foods also contribute significantly to constipation. So limiting those foods will be very, very helpful if you're dealing with constipation in your child, or if you're dealing it with yourself or other members of the family. Those are the main issues we start to talk about with families dealing with constipation. Processed foods and sugars are also very, very hard on tummies and make it hard for us to form softer stools. Constipation is one of those things too that we're also walking around dehydrated, the majority of us. Ideally we want to drink half of our body weight in ounces to get as close as that as we can. That is going to be something I strive for all the time because I am so bad at drinking. Our thirst reflex is terrible. By the time we're thirsty, we're already dehydrated. So making sure your little ones have water at all times. If you need to put a little bit of fruit in that water, that's awesome. Try to stay away from the sugars if you can. They are very constipating, not great for teeth, and not really good for our bodies in general. So limiting any sugars will be helpful for constipation too. I want you to know a couple things before I talk about medications that can be used for constipation. I always talk to families about adding in some ground flax Ground flax is a great product that you can add to anything. It's very yummy. It's great tasting. You can add it to yogurts. You can add it to cereals, pancakes, waffles, anything truly. You can add that to that you give your child or yourself. Ground flax is absolutely wonderful. You probably know of some other foods too that you can add that are higher fiber. Even just putting fiber on products is great. Those are really, really great things to think about. So to start off with, nutrition is really, really important. For kids that are way past that point of where they're in significant pain, even adults where they're having harder stools, their tummies hurt, their tummies are distended, that's where you can start using some of the stool softeners. Stool softeners can include things like Miralax, it can include lactulose, and those are two of the main products that we use and that you'll find in over-the-counter at Tops or Wegmans. I generally tell families about those when they really, really need it, and it's a temporary fix. There are some children that unfortunately, and adults that have to use it frequently for their own care. Just for an example, if you're having a little girl that gets frequent urinary tract infections due to constipation can cause urinary tract infections by making that bladder retain urine. And anytime you have standing water, you're going to have the possibility of growing bacteria in there. So some people have to use these stool softeners on more of a chronic basis until we can really make sure that the stools are soft so they're not at risk for UTIs anymore. Growth and time can help that tremendously. So for those of you that may be taking stool softeners on more of a chronic basis, please know that I want you to continue to follow your doctor's instructions for that. And getting recurrent UTIs is really not something I want anybody to deal with. So those are the kind of things you can use. If you need to use Miralax or lactulose, I always tell families 3 days. One dose isn't going to help. It's something you need to use for up to 3 days. Then you start to work on diet changes. Prunes, those kind of things are wonderful. Apricots are great too. A lot of families it's kind of a negative connotation when I mention prunes, but they're really pretty tasty. So if you start your kids eating prunes or even a little bit of prune juice when they're young, I think it's really a good thing to have in your arsenal for constipation episodes. Some of the triggers for constipation can be vacations where you're having to eat out a lot, or you're just kind of having a great time and wanting to partake in all the snacks available. Those are things that can really occur. Camping, it can happen to, generally little ones and even adults don't like to sit on the toilet very long. So encouraging extra time on the toilet is helpful, letting them know that they do not have to rush. Put some books in there if you need to. Making sure that your children and everybody in your family knows how important it is to be able to spend enough time in that bathroom. Because we're bad at it. Every single one of us. We feel like we don't have any time to go to the bathroom. And I'd like to change that mindset a little bit too. In terms of constipation in general, I want you guys to always know to reach out to your doctors. Pediatricians, adult doctors, family med doctors. Reach out to your doctors so you can get some help. There's also the one last thing I want to talk about is when you reach a point where you're having significant difficulty with your children, or your young adolescent or even an adult, they do have some quicker fixes such as suppositories, glycerin suppositories, and Fleet's enemas. Those are all over the counter. They give great instructions. It's really one of the very last resorts to try to move that stool through. But if you have stool that's accumulating from the top down, you're going to need more than just an enema or a glycerin suppository to help you out. Please remember hydration is key, especially in this hotter weather as we're starting to get warmer. Making sure that we give ample fluids. Really, water is the best bet to give to make sure that your stools stay nice and soft. I think for now that's it. If you have any questions, please feel free. Let me know in the comments, and I hope this was helpful. Remember, everybody's different. Every individual is different. There's different reasons for constipation that's very tough to manage. So remember to let your doctor be involved, and your doctor will ask for a GI specialist to become involved if that's the case too. making sure that you always look at nutrition, and keeping a food diary for somebody that's dealing with constipation is always enlightening. I want you to know that. One last thing I wanted to mention, and all the nurses at the urgent care laugh at me every time, but frosted mini wheats is one of the highest fiber cereals. One of the best things I ever gave my kids when they were little. You would open up our cupboards and you would have every flavor of frosted mini wheats. What's so great is the fiber content, and there's just sugar on the top. It's not significant sugar, it's only placed on the top, but I am telling you that that amount of fiber is great. So I have no stock in mini wheats. I just want you to know that that's a great cereal if your little ones can eat cereal, or they like cereal, to help increase the fiber in their diet. Okay, I hope this is helpful, everybody. Have a great day. We'll see you soon.